We described the PK/PD properties of antibiotics used for UTIs and distinguished UTI presentations by symptoms and urinalysis findings, and ensured urine cultures are taken in patients with pyelonephritis or recurrent cystitis. Now let's list the top 4 common uropathogens that cause UTIs.
So here on the left, I have uncomplicated UTI, which is the focus of this topic. And this could be cystitis or pyelonephritis. But as you can see, the number one organism that causes these uncomplicated UTIs is E. coli. So E. coli is the number one organism. You should always cover for E. coli. So whatever agent you choose, you need to make sure that it has a good coverage for E. coli. And then outside of that, you have Klebsiella pneumoniae causing a lot of these infections, and also Staphylococcus saprophyticus, as well as Enterococcus. So these are your top 4 organisms that commonly cause urinary tract infections. Now, note that like other organisms can cause UTIs, but they're not as common. So Pseudomonas, for example, Pseudomonas aeruginosa, there's about like 1% case. So you don't need agents that cover Pseudomonas for every patient. Occasionally, by occasion I mean like there's like 1% chance that they may need it, and by then we will have cultures and basically if that 1% shows up is when your antibiotic is not working, and then we get cultures and then you find Pseudomonas. But you do not want to cover for Pseudomonas for every patient with UTI. You want to target the top 4. And of course, when it comes to complicated UTI, you start to, it's still E. coli is your number one organism, along with Klebsiella and Enterococcus. However, note that in complicated UTI, you do start to see more of Candida species causing UTI due to Candida, or Candiduria as we call it. Now, I know in complicated UTI, they are more likely to be due to resistant organism. So, for example, look at Pseudomonas. So Pseudomonas are more likely to cause complicated UTI, but still is around 2%. So it's still something that you do not want to cover empirically for everyone. So you do not need to cover for Pseudomonas for patients with complicated UTI. If you happen to find it on the urine culture, that's when we use an agent to treat it. Otherwise, empirically, we target the majority. So you need to target the top 4, and in this case, also Candida when we talk about complicated UTI. But I want you guys to focus on uncomplicated UTI. So just know these top 4 agents cause uncomplicated UTI.